and then I'll trim off all of this front end chit chat until we get started here. We'll get a couple more people joining here a little bit late. But welcome, Richard. Welcome, Scott, Toby. We'll get started here in just a minute.
Sure.
Yeah. So, Scott, did you stay in town for the holidays, or did you do some
I
traveling?
did. My both my kids were here. Well, my son lives here, but my daughter lives in Denver. But they came down with the most important thing, my grandbaby. So
Yeah. Yeah.
and the everybody says their kids are cute, but oh my gosh, she's got me wrapped around her little finger. That's for sure.
That's awesome. Yeah, we were really blessed too. This was the off year. We usually, for our married daughters, usually only get them every other Christmas, right? But for whatever reason this year we got everybody here again this year,
Nice.
we had them all together last year, so that was really a blessing. Our youngest daughter didn't tell us last year when we did our family trip that she was even expecting. So that little
Ah,
that little 4-month-old got to spend Christmas with us, so that was tons of fun.
well, my granddaughter is 21 months now, so she's going everywhere.
She's getting into everything.
It's all go or all stop.
Yeah, yeah, exactly. So. Oh, excellent. Well, appreciate everybody joining. Happy New Year to everyone. Great to see you. Dr. Lewis is here in the house. Great to see you.
Good morning.
Nicole, Richard, Jonathan, Chris. Excited to hear from Chris today. Everybody knows Chris from BIOLYTE, but he's going to share something new with us today. It was fairly new to me. Maybe you all are all very aware of it, but and excited to hear his presentation today. So give it just one more minute and then we'll kick this off. Like I said, I always get the last minute.
That's where we got a couple minutes. I just wanted to give a shout out to Chris. He's been very helpful to me. He's always returned my phone calls and helped me with a name or two to maybe go to get information. He's just a really good guy. Besides just doing great things with his products, but he's just a good guy too.
Yeah, excellent. Appreciate that feedback. Yeah, right. So again, for those that are just joining, this is the More Profit Roundtable. We host this on the second Wednesday of each month. So it's only a monthly meeting. We've introduced some amazing products and services here. And we have, I've never been more excited about the opportunities for community pharmacy. I mean, the last few years, 3 or 4 years, have been absolutely dismal, in my opinion. And that's just my own personal opinion. But I am super excited about the opportunities that are available for community pharmacy now. Let me just answer a quick text, and then we'll get started here. Still getting a few more people joining, a couple of our presenters. So. Um, all right. But we'll go ahead and get started about 4 or 5 after the hour and want to make sure that we end on time. I know all of our pharmacies that are participating today, time is so valuable and quite often are the only pharmacists on the bench. And so we want to make sure we get this wrapped up in under an hour. But we have absolutely amazing information to share with you today and so excited for you to hear about all of these wonderful services. So my name is Breck Rice. I'm the co-founder of ServRx. Been working with community pharmacies now for over 20 years, but about close to 23 years now. And I absolutely love community pharmacy. I will do everything in my power to be able to help community pharmacy be successful. As I mentioned a little bit earlier, as we were just letting people into the room here, the last few years has been very dismal for pharmacy, unfortunately. But I have never been more excited about 2025 or any new year than I am now. Super excited about the opportunities that are now available for pharmacy. So happy New Year to everyone that is joining. And for those that will listen to the replay of this, we've had about 40 people request the recording of this. It couldn't be here today. So happy New Year to all of you, and I'm excited to share this amazing program, the More Profit Roundtable. Profit is key. We used to talk a lot about revenue, but no, it's what you actually get to keep. It's the profit you actually get to keep that's so important and is the lifeblood to community pharmacy. So excited for you to be here and excited for you to hear about all of the things that we're going to share today. So besides co-hosting a couple of podcasts, as I mentioned, I'm the co-founder of ServRx, and for over 20 years, I've been helping pharmacies get fair reimbursements, bypass the PBMs to get fair reimbursements. But that program is only for workers' comp, so not every pharmacy sees a lot of work comp patients. And even if you do see a lot of work comp patients, you may only be able to send a certain portion of those to ServRx because the PBMs have their greedy hands in everything. So only about 1/3 of those claims we can help you with. So again, I can only help you about 1/3 of the time on those claims. So what else can I do to help the industry that I love? Well, I host the PBM Reform podcast, and I work on trying to bring awareness to the general public and to senators and lawmakers about the pharmacy benefit managers and all of the things that need to change with that industry. That is a super, super slow process. And so that's why I then launched the More Profit Roundtable to bring additional services and additional profit to our community pharmacies while we continue to work on those things that take a long time, like PBM reform. So most of you have seen this Fortune report talking about, over 1,200 independent pharmacies that closed their doors. And this is an old report. I've actually seen it closer to 3,000 pharmacies go out of business and close their doors. That is not the direction we need to go. That's leaving pharmacy deserts. And why is this happening? Grab a drink. It's because the PBMs are aligned with the big payer mafia, the insurance mafia, and they are literally trying to put community pharmacy out of business. We need to stop this. This is just one PSAO update. ServRx is partnered with every PSAO and buying group in the country. We are their preferred processor. But this is just from one of the PSAOs, and as you can see, some of these closures were very recent. Merry Christmas to this pharmacy here, closing on Christmas Day. A Happy New Year for this last pharmacy that had to close on New Year's Eve. So with all these closures, I feel that it's very important that 1/3 of the revenue and profits being generated from independent pharmacy needs to be in non-dispensing revenue, because if you look at the profit margins back when I first started in the industry, they were about 36%. They were fair. Today, they're only 3 to 4 maybe 5% if you really have good contract in place, right? And in fact, there was a study that showed about 1/4 of medications dispensed now in the United States actually walk out the pharmacy's door beneath the acquisition cost of the drug. So you get reimbursed less than even the cost of the medication. So therefore, it's not covering any of your overhead for, employees cost, your lease of your building, utilities, anything like that. It's literally losing money on 1/4 of those scripts. So feel like you need to move 1/3 at least of your revenue outside of dispensing. And so that's why we've brought some amazing programs today to share with you about how to do that. When I was a little boy, I used to play Pee Wee League hockey. Loved it. Your pads weighed more than the kid, and so you were indestructible. But one of my all-time favorites was Wayne Gretzky when he was playing. And this is a famous quote that a lot of people have heard before. When he was interviewed and asked why, he was such a great player, he said that he skates to where the puck is going to be, not where it's been. That is the exact same mentality we need as community pharmacy. We need to go where the profits are going to be, not where they've been. It's kind of that sign of insanity, right? Keep doing what you've always done and expect a different outcome. Well, we need to create a different outcome. And so that's why I'm excited to share all these opportunities with you today. There are going to be a lot of things that are going to be thrown at you. Don't stress over it. I'm going to send you the replay, and then I'm going to make myself available, and all the presenters are going to make themselves available to you to do one-on-ones to help navigate all of these opportunities to implement them and make sure that you're not on your own trying to do all of this. And if you can just take one or two things away from today, you're going to be so much better off for it. So let me play a little explainer video here for you.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry, just send the claim to ServRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.servrx.com.
I'd like to invite my friend Will Shaw to the stage now to tell you a little more about our program.
Absolutely. Great day, everybody. Happy New Year. Like that video said, ServRx, we love community pharmacies, and we're just here to help you keep those fair reimbursements that you legally deserve in the pharmacy instead of the PBM pockets. And we have a chart right here. For example, if a patient was to come into your pharmacy, they need a meloxicam for workers' comp. If you was to process that meloxicam through a PBM network, your pharmacy may be reimbursed $3 to $4 for that medicine. But now, when you're adjudicating that workman's comp, that meloxicam for workman's comp for that patient through ServRx's Ben and PCN, we are seeing pharmacies reimburse anywhere from $101 to $105. And that will be reimbursed to your pharmacy in 30 days if you're with a PSAO directly through your central pay. Or if you're an independent pharmacy, that will be reimbursed in 45 days directly from ServRx. We do have a live help desk that is available 7 days a week. So if the pharmacy is receiving rejection for a claim, you can give our help desk a call and they can help you receive that paid label. We do the legwork for the pharmacy, so you don't have to worry about trying to contact the adjuster, et cetera, et cetera. If it ever escalates to that, we do have a team that will reach out to the adjuster to make sure everything is, and to keep the pharmacy in compliant, make sure everything is up and up with that claim for the pharmacy. Again, this is a free service for the pharmacy. We are partnered with every PSAO in the country. So the only thing you will have to do is get enrolled. My contact information is attached in the chat. If you have any questions, you can feel free to reach out.
Thank you, Will. Appreciate it. And again, like I said earlier, we do understand that you have contracts with certain PBMs. They kind of hold you hostage, right? If you want United Healthcare, they, 65 million patients in United, then they kind of hold you hostage and say, okay, you're going to take all of the Optum plans, and they bundle those. So, but there is still about 1/3 of all workers' comp claims that will fall outside of those PBM networks where you can get those fair reimbursements. So if you're not enrolled, please get enrolled. Like Will said, it's totally free service, just a value added service to all of your the other services your PSAOs offer you. I want to invite to the stage at this time a representative from the National Association of Nutrition Professionals. Now, every one of your pharmacies, I believe, carry supplements, right? You have nutritionals. Well, this is taking it to the next level. And we have the main person, the executive director here, to share with you about this amazing opportunity. So I want to invite to the stage Nicole.
Thank you, Breck. Good morning, everyone. And thanks for having me, Breck. I really appreciate the opportunity to share with your audience an opportunity. I love the quote that you just put up, and that's exactly what I'm about to talk about, is going where the puck is or is going to be. So currently, the dietary supplement industry is about $194 billion. It is projected by Polaris Market Research that by the year 2032, the industry will be a $380 billion industry. That's a tremendous amount of growth. I actually came from the managed healthcare industry, and I'm very familiar with how PBMs operate, what their end goal is. And I'm also now, of course, being in the holistic nutrition industry, am very aware of how consumers are way more interested now in finding alternatives to prescription medications. Of course, prescription meds have their place 100%, but there are so many alternatives in the dietary supplement industry, and the profit margins are phenomenal, and you're not going to be controlled by a PBM when you're working with dietary supplements. So our association has developed a certification. It's a certified dietary supplement professional. And essentially the way that it works is if you have somebody on your staff, or if you yourself would like to go and learn more about dietary supplements, you would go to an educational program outside our association. Currently, the American College of Healthcare Sciences is offering a program that teaches specifically to the taking of this certification exam. Then you would come to the association and take the exam for the association. The price point is very, very good. The educational program through ACHS is $500, a little bit less than $500. Taking of the exam is very, very cost effective. Excuse me, we did this on purpose because we know that pharmacies are closing, community pharmacies are closing. And so we highly recommend that you look at having somebody on your team become a certified dietary supplement professional. Here's what we know. When people buy dietary supplements on their own without consultation, they very often will buy products that are not properly suited for them and that won't work. What we've learned is if they are sold products that are right for them by someone who understands human physiology and can speak to what's the difference between magnesium, citrate, all the, glycinate, all the different versions, and what you as an individual need. When the customer takes that home and they use that product and it works, they will not only come back and buy more from your pharmacy, they're going to tell everyone who will listen. And so I want to invite you all to please take a look at our website. The website address is nanp.org. If you're interested in having your pharmacy staff become certified, I would ask you to get in touch with Tiffany on my team, Tiffany Perry. And her email is tiffany@nanp.org. If you'd like to learn more about what the exam entails, what's being tested for, one of the big pieces that we test for are the legal parameters around what you can and cannot say about a dietary supplement claim. You can't claim that it can do certain things. You have to be very careful with your languaging. And there is a lot of information that we make available that people can study and that we test them on in the certification exam to make sure that you're not being put in a liable position. Nobody wants that. So please take a look. If you'd like to learn more, I recently did a podcast with Jean Bruno, the vitamin professor. You can check it out on YouTube. It was a great interview. Jean actually was involved in the formation of our certification exam, and he truly is the vitamin professor. He's a great resource for other things as well. And I'll leave it there.
Yeah, thank you, Nicole. Appreciate it. And we'll put Tiffany's contact information in the chat for a one-on-one. Just to highlight some of the things that we've brought over the past year and well, over a year now. You know, BIOLYTE being one of those you see on there, which now is available through your wholesaler, and just some of the other products and services here. Wanted to invite Toby to the stage now. This is a brand new product that is launching this year, and so I want to make sure everybody is aware of this cool new product. They sent me a prototype. It actually does work. I suffer with allergies, and this is amazing. So Toby, tell us more about Clair.
Yeah, so Clair was actually invented by Dr. Azeez. He's an internist, and he found a lot of times in a post-op situation from open heart surgery, patients would develop an infection from bacteria and viruses such as MRSA that were in their nose. So they started to swab noses to actually remove those different irritants, allergens, and bacteria. And then he thought it'd be a good idea for people to, in general, start cleaning their nose, because it's a neglected part of the body generally. When we shower or do anything else, we brush our teeth, but we rarely clean the inside of our nose. Now we do have reactive measures such as the neti pot or the lavage for people that have allergies, but this is a more proactive approach where you actually have, I have a prototype right here in front of me. You fill the tank with saline, so salt water, right? And then there's a pump in the device that will saturate this cotton tip and oscillate. So it oscillates similar to an electric toothbrush. What that does is just remove the allergens and anything that could be causing you to clog up your nasal passageways and relieve you from congestion. So this is something that we actually have started to take pre-sales for from a consumer standpoint, and some our pharmacies have decided to purchase units of our device, and consumers are buying this at $99. We're selling them wholesale to independent pharmacies at $69. So there's a $30 profit per device sold for your business, that is. And we're also backed by Dr. Rubin. He's an allergist, so there's a lot of medical backing behind our device. He has about 2 million followers on social media, so he's telling his audience, go out and buy this thing. So hopefully they land in one of your stores and not only buy this device, but hopefully any other product that you're selling in your pharmacy.
Yeah, thank you, Toby. And when is this available for the consumers?
This spring, so at the very earliest, early March, at the latest, about mid-June. So we are taking $10 reserves right now. I put the reserve link in the chat. So that just reserves. You can reserve as many units as you want, but after 5, we'll give you a free demo unit that you can have in your building.
Okay, thank you, Toby. Appreciate that. Wonderful product. Please look into that. And I want to invite my friend Jonathan Tanner to the stage next. I think everybody is familiar with this cool product, but if you're not, you need to get familiar. Love this product.
Grateful to be here, Breck. Yeah, BreathRx. I'm just humbled to be the founder and CEO of this company. It's just a fantastic product. What BreathRx is, it's basically sugar-free pop rocks with zinc. So it's a popping breath mint. And how it works is the zinc neutralizes the gas in your mouth. All that popping activates your saliva, and all those little tiny pieces scrub your mouth. So it's not just fun like pop rocks growing up, but it's actually functional. So it really is just, it's a fantastic product. What you're also finding is with this product, pharmacies are using it as a tool. So for doctor detailing, it's great because you're walking into that doctor's office and you're bringing something that's unique. You're bringing something that it's different because you're not Dunkin' Donuts. Why bring other people's products? And you're also bringing a product that actually deals with some of the side effects of those medications. So a lot of those medications out there cause dry mouth. This is a solution, for these patients. And we've actually had pharmacy owners tell me, like, look, I got staff who are coming to my pharmacy because they want to buy more breath rocks. So we have 4 flavors now. When we launched at NCPA a little over a year ago, we had the 3 flavors on the screen there, the mint, the cinnamon, and the watermelon. We just launched blue raspberry a few weeks ago. It's fantastic because it has this extra cooling sensation to it. So people just love it. The retail price is $2.99. The wholesale price is $149. So you've got that 100%, Keystone margin. To order, just go to breathrocks.com, set up a wholesale account, and we'll ship directly to you. We also include free bag stuffers that talk about the product. We also provide a 3-tiered rack, as you can see here on the screen, that carries 3 of the products plus has a billboard. So it really is just it's a fantastic, really unique product, and people are being creative with it. I mean, I've got a couple pharmacies that say, yeah, I'll just put it by the checkout, because when I want to get people to hit that, minimum $5 charge to use their card, I'll say, hey, buy the breath rocks. If you don't like it, I'll give it back to you. But people just love it. And the last thing I'll mention is that we've raised over $1.8 million almost exclusively from pharmacy owners for our seed round. We just had Thrifty White. They invested. Montana Family Pharmacies, they just invested. And we're going to be closing up our seed round here on January 15th. So if that's something you're interested in doing, great. Please reach out to me. But most importantly, get this product into your pharmacy, because it's the type of thing that your existing patients will love, but new patients will come in looking for the product. So just grateful to be supported by so many pharmacy owners with such a fun product that we have that really, really works as a functional breath mint. It's not just, perfume candy like Tic Tac and Altoids.
That's awesome. Thank you, Jonathan. And I just saw Bruce Nealon showing off the 3-tiered rack on LinkedIn this morning. He was visiting a pharmacy and showing off that rack. So amazing product. Jonathan was kind enough to send me some samples out for stocking stuffers. My family loves them. And a new flavor that I got to sample in Columbus at this last year's NCPA is that it's the mango tahim. Oh my goodness, that is amazing! Can't wait for that one to come out.
Yeah, here's the in the laboratory sample box. So it's coming soon. So thanks for all the support, Breck.
Yeah, good for the Southwest here. Everybody loves mango and tahim. So next to the stage, I wanted to invite Dina. She is with Calbiotech to talk about the Visby program.
Yes, how are you guys? Thanks for the opportunity. I work for Visby through our company Calbiotech. Visby, it's great. It's a great Visby medical device that only instrument-free rapid PCR testing. Our rapid PCR testing provide accurate and reliable result for healthcare provider all across the United States. We are a medical diagnostic company with portable PCR testing technology that may be implemented in both clinical and mobile laboratory and pharmacies. As you know, the flu season is here. According to the CDC, flu and influenza illness are on the rise. So our testing, it does PCR device with 99% accuracy. It is the first of its kind CLIA-waived conformity point of care PCR device for flu A, B, and COVID-19. We also have another device that it's not only for flu, but we do female STI POC testing for women. So this is a great thing to have and add into your pharmacy for patients.
Awesome. Thank you so
I'll
much.
put my information on the chat as well. If you have any question, you can email, call, and I will send more information.
Yeah, thank you very much. Yeah, amazing system, because so many people immediately jump to COVID these days. Oh, I must have COVID. Well, now you have a test that can rule out flu A and flu B as well as COVID-19. So thank you. And please put your information in the chat. Next up, GermsRx. Let me show you a little quick explainer video about this amazing product.
Have you worried about the germs and bacteria your children pick up at school or while playing outside, just to bring those same germs back into the house? Or you have an older parent whose immune system doesn't fight as hard as it once did? Introducing myshield sanitizing wipes and sanitizing body spray, a more effective answer in the fight against germs and bacteria, available in large or travel size formats. Our cutting-edge antimicrobial nanotechnology, Zetrasil, creates a microscopic bonded barrier on your skin and other surfaces, keeping you safe from 99.9% of common germs for up to 4 hours. Our sanitizing wipes are water-based and stay saturated for longer, allowing you to cover more surfaces per wipe with our proprietary virus and bacteria-killing solution. With a pack of these wipes in your bag, it's easy and even enjoyable to sanitize surfaces and skin everywhere you go. They're safe for children, safe for pets, and safe for you. If you prefer a spray to a wipe, our sanitizing body spray includes all the same virus and bacteria-killing science as our wipes do. Simply spray anywhere to sanitize your skin or your clothes, avoiding your eyes and mouth, for up to 4-hour protection from viruses and bacteria. MyShield's sanitizing body spray is available in 2 ounces, 16 ounces, and 1 or 5 gallon sizes. The sanitizing wipes come in 2 resealable pouches, from a travel size of 20 wipes or a large size of 50. Come get your MyShield on and visit GermsRx.com to discover how our innovative products can shield you from harmful diseases and infections.
So if you're not carrying this yet in your pharmacy, you need to, if not for your patients, for your employees. This will keep your employees healthy and coming to work every day as well. So I want to invite Scott up to the stage at this time to talk about MyShield.
Hey, Breck and everybody. Breck measures this in grandkid coverage. He can take one of the large wipes and he can wipe down both grandkids, and they're good to go for a few hours out playing in the backyard or in the garage or climbing over anything. And it's really funny when he tells this story, what he does with the grandkids. But more importantly, we're all kind of alcoholed out, aren't we? All the hand sanitizers and the products that use alcohol for the active ingredient to kill the germs. We have a new way of doing things where we create a bonded barrier, basically, that when the bacteria and virus cells come in contact with it, they get destroyed. And I would be more than happy to share more information about that. And I've partnered with an amazing company that has a program, live real-time program, where it can tell you if you're doing a good job washing your hands. So we can put our sanitizing soap and our hand sanitizer in a area to clean up with, that can give you real-time thing is how your employees are doing, because it can be matched up in the programming as far as to badges, to any kind of platform that you want to do. So it's we can take care of pretty much any situation. the product profit margins on the for pharmacies is anywhere from 40 to 80%, depending on the product. So you have enough to really make it worth the effort and getting it in your pharmacy. So I put my information in the chat, and I look forward to talking with everybody.
Yeah, thank you, Scott. And yeah, he's I tell the story all the time that I won't travel without that. And so occasionally my grandkids will travel with me, and I'll take those wipes and literally wipe them from head to toe, because I know they're going to touch everything in the airport and on the airplane. And then I take another wipe and I wipe down the tray table, the armrest, the seatbelt, because they just play with things, and we've been able to keep our family really healthy with this product. So again, if you're not promoting this to your patients, please have it in your pharmacy for your own employees, and you'll have fewer sick employees out of work, and you're trying to scramble to find coverage for that. Physician detailing is really important, and GRX Marketing is not able to be here today, but they're a company that we've partnered with to help with physician detailing. So if you want more work comp claims, if you want more physicians to talk to collaborate with some of the other programs that we'll tell you about, I highly encourage you to contact GRX Marketing. I'll put their contact information in the chat for you. But would at this time like to bring to the stage my friend Chris, who most of you, like I said, know him from BIOLYTE. Well, he's now at Pharmacy Marketplace. Chris?
Hey, Breck, how's it going?
Happy New
Thanks
Year.
for having me. Yeah. Thank you for letting me share this, guys. This is something I'm really excited about. Obviously, Breck talked about some of the challenges of the pharmacy industry with reimbursement, and this is a technology platform that's built to help with cost of goods, essentially, using the pharmacy's data from their primary wholesaler agreement and then the secondary market to really show them how to shop within the frameworks and hit the sweet spot of ordering. So it's customizable to their dispensing, and it's going to give recommendations on what to shop outside. But the main feature is we have their primary agreement and all their data to make sure that they don't fall off of the rebate cliff. So essentially, you can take advantage of all the agreement of the primary wholesaler and find the opportunities outside without shooting yourself in the foot. So we're happily working with about 800 stores right now, and integrating with the wholesalers and just trying to find a more cohesive relationship for pharmacy owners with their suppliers. So be glad to talk to people outside of this. I put my information in the chat box, and would love for you to set up a time to demo the platform.
Yeah, you see the little QR code there in the lower right-hand corner. You can scan that now to book a demo. That was really smart to add that to your flyer. Love that. But yeah, just a wonderful program. They work with all of your suppliers so that you can absolutely guarantee that you're getting the very best costs. So excited about this program, and thanks for participating with us, Chris. Good to see you again.
Appreciate it.
Yep. So again, everyone that has presented, if you haven't already, please put your information in the chat. Real Value is one of those secondary wholesalers that has been a great supporter to the More Profit Roundtable. I have pharmacy partners that use them exclusively, not even as a secondary, just because their pricing is so good that it makes up for any rebate or anything you're getting from your primary. So I think most people know who Real Value is. I'll put their contact information in the chat. There's a nice little video too about the new robotics system they've put in to help streamline their services to you as well in delivery. Have you guys heard about this yet? Hypr. It's not in every city yet, but it is a flat rate same-day delivery service. And it's I know you've heard of other flat rate or other gig workers like Postmates and others that do delivery. But they fake you out. They tell you it's going to be one price, but then they tack on a fuel charge and then a mileage charge, and pretty soon you're paying $12, $15 per delivery. This is a $7.95 flat rate, but it's not in every city yet. They are HIPAA compliant, which is the other thing you're not getting from those other gig workers. You have no idea. You may be delivering drugs along with a pizza, and there's no HIPAA compliance with that. So this program is completely HIPAA compliant, specifically for the pharmacy industry. So I'll leave the contact information in the chat so you can get more information about this and see if it is in your area. So I'm going to show a quick little explainer video about this next program for you. Let me bring this up real quick.
CERESKILLS is a clinically proven and paid for by Medicare program that literally prevents and often reverses memory loss, cognitive regression, loss of balance and coordination, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. CERESKILLS comes with a 23-year record of success in working to improve neuroplasticity in the cerebellum, which will improve your quality of life, helping you to remain independent for as long as possible. Your personal coach will reach out to answer any questions and will be there to support you all the way. Please watch the videos below and tap the enroll button to get started.
So I love the feedback I've gotten so far for this program. I just put my in-laws on it. They're in their 80s. They absolutely love it. It's covered by Medicare Part B. And so I encourage you to look into this, and want to invite George Veronis to the stage at this time to tell you more about it.
Yeah, well, thanks, Breck. I mean, this is short and sweet because we do a more intense, let's say 20-minute demo describing everything and showing how it works. But bottom line is, I know you've been preaching clinical services and medical billing for a long time, as long as I've known you. And the good news here is by implementing CERESKILLS, it's a really fast, no-cost way to get started in the other programs. Like, just for example, if you have even 100 patients, which is really a low end, that would get on the CERESKILLS, you get reimbursed by Medicare $25 per patient, or basically $2,500 a month, and probably will be averaging $200 to $300 per pharmacy. So you're talking about $5,000 to $7,000 to implement this program. That's simply people getting a link, going to this, signing up. CERESKILLS does everything. You can see it's been around 23 years, 22 years, so it's well proven. And the seniors stay on it basically for 10 minutes to get those kind of results. And as long as they do it 16 times in a month, they get reimbursed by Medicare, and then you get paid also at $25 per person. So this is a program that's pure profit, so it'll generate enough money basically for implementation and credentialing for additional clinical services also that you've been talking about, which is that phase 2 and 3. But most importantly, it helps seniors, it helps them get healthier. And then we'll show you other ways how you can use CERESKILLS videos here, and it can lead to more business in your community. It would lead more people coming to use your pharmacy. So to keep it short, I basically say sign up for a 15, 20-minute detailed Zoom with us so we can go through more detailed presentations, and then you could see how it works exactly, and you can get started, and we'll obviously answer all your questions. So, Breck, thanks for the time, and everybody listening. Again, it's short videos, one presentation. People implement it, not a lot of work, and basically the seniors love it when they get on it, and you do a great service to them. So that's CERESKILLS in a nutshell, and turn it back to you, Breck.
Yeah, thank you, George. And one of the really amazing things about their program is that they do the physician detailing for you. So they'll actually reach out not only to the doctors, but also to your Medicare patients. So amazing marketing solution behind the service. And like I said, getting amazing feedback from the seniors that are utilizing it.
Yeah,
They get their own personal coach.
Yeah, they get a personal coach the whole time. Every 30 days, they get reassessed. They'll stay on it 5 months to 12 months, and then you have new patients coming on it. So it's real simple for everybody to do, and it's really hands off on your end of it, which is, really good to see from that perspective. And I can tell you the pharmacies we started introducing it to, we've had zero resistance. In fact, everybody's wanted to implement it. So it's that good. All right.
Yeah.
Back to you, Brett.
Thanks. Now, back to my preaching about getting into clinical services. Absolutely, our pharmacies need to do that. And there's some great programs out there, Outcomes and CPSN and others that are doing everything they can to help pharmacies operate at the top of their license. And they're great. And I appreciate that. This program actually gets you well beyond. So this enhances anything and everything that you might already be doing with CPSN or Outcomes. This takes it to the next level. This is the Independent Pharmacy Provider Network. I'm going to show you a quick explainer video and then turn some time over to their founder.
Why join the Independent Pharmacy Provider Network, IPPN? 1. Access new revenue opportunities and make thousands more than you currently make doing the same service types. 2. Increase billable revenue beyond current pharmacy limits by using the new clinical care delivery contracts negotiated for you by IPPN. 3. Increase foot traffic and sell more retail items and services. 4. Increase community healthcare equity and engagement for better outcomes. 5. Create your own community care program to support your community health initiatives and allow local providers to participate in your network created through IPPN. IPPN provides the turnkey solution to make this happen and allows for increased revenue and opportunity for your pharmacy.
Now that we have your attention and discussed how we can help your community and increase your revenue, the following are key points of IPPN. 1. Virtual direct supervision enabled software. Direct supervision through the IPPN application with real-time audio-visual technology instead of in-person presence. 2. Collaborative practice agreement. IPPN provides the CPA between IPPN for the technology, a provider who provides incident to billing supervision, and a pharmacist or other provider who provides specific services as these components fulfill the intent of the Medicare incident to billing provision. 3. Community provider recruitment. IPPN provides recruitment services for providers to participate in the community care program. 4. Contracting with payers for clinical services. IPPN provides contracting services for Medicare and other payers for clinical services delivered through the IPPN community care program. All services under the CPA fall outside of all direct pharmacy billing and billed as a clinical service under the new payer contracts. For example, bill your vaccines as a clinical visit under the CPA under the supervision of the provider assigned to the patient and immediately increase revenue. Again, IPPN provides the turnkey solution to make this happen and allows for increased revenue and opportunity for your pharmacy. Join IPPN today at www.ippnhub.com.
Thank you again, and remember to join the Independent Pharmacy Provider Network.
Go to www.ippnhub.com and start increasing your revenue today.
So one quick story. I introduced IPPN to a pharmacy partner of ours. They have a few locations down in Alabama. And once they got set up, the feedback was, hey, Breck, you totally undersold this. It is everything we are looking for. I just made the introduction. So I evidently didn't do a good enough job explaining exactly how beneficial this is. And so I do want to, and by the way, they had already hired their own MD. They actually have a doctor on staff. They were embracing clinical services 100%. And this absolutely enhanced everything that they were already working on. So let me bring the expert to the stage at this time, Ray Vono, and tell us more about IPPN.
Thanks, Breck. I appreciate it. Yeah, I think a lot of times when pharmacies want to set up the clinical services, they have to realize that they need an application. They need a collaborative agreement that works within the state that the pharmacy is operating in. They need to have payer contracts. Although the payer contracts, what we're seeing with some of our clients is that we're able to bill out of network, and they're receiving significant amount of reimbursements. to their claims. In some cases, what we've seen is 4 and 5 times the Medicare rate for just the basic reimbursed amounts. Some of the challenges, and we're actually seeing the same challenges, is trying to explain that to some of these doctors that are willing to get into a collaborative agreement, but they're not willing to fully participate. And so that's one of the biggest challenges that we have to overcome, and it's something that we are addressing. But once you have that collaborating provider set up, we're able to see patients, bill patients, and some of the volumes that we're seeing range anywhere from just 1 to 2 encounters per day, all the way up to 200 to 300 per week. So you're getting a significant amount of traction once that collaborative provider. But again, getting started early, getting out to your community, looking at all the providers that you want to access, and then implementing a program through IPPN. We handle that. We do a turnkey, and again, we're staffing up because of the interest level, and it's growing. So thanks a lot, Breck.
Yeah, thank you, Ray. If you have not done a demo of this, we'll definitely put that link in the chat for you. You need to get scheduled to see how this can help you. Every community pharmacy needs to be providing more clinical services. So excited to have everyone here today, and I know we're getting short on time, but I want to make sure that I get some time to Richard and Damar, because this is taking all of these services to the next level where you can actually keep more of those profits that you have generated and even enhance, double those profits. And so it looks like, Richard, you're going to go first here. If you could quickly give a teaser so that people will just set up a one-to-one to you and get this analysis done. If you haven't done this, I have pharmacy partners that are literally saving thousands, tens of thousands on taxes, 100% legal. Richard, you're on mute. Still on mute, my friend.
Still on mute. Now I should be able to hear me, right?
Yep.
Got me? Okay, cool. Yes, you're right. And I think we're approaching $200,000 or more what we've been saving for pharmacies since we started working with you about 6 months ago. So, Breck. So yes. So what I'm going to jump through a bunch here. We are a tax law group. And what we do is we focus on nothing except reducing the taxes of the owners of small to mid-sized businesses. We've been doing this since 2002 as a group. Our managing partner of the law group is a man by the name of Mike Fussell. Mike is an attorney. He's a master's of law in taxation. He's on the National Tax Court Review Board, and he is a CPA. Other than that, he has no initials after his name. But he's been doing this for years. We have almost 4,000 clients in place throughout the entire United States. In every state, this is available. There are certain states that have higher taxes, like Illinois, New Jersey, California, Massachusetts, et cetera. And we obviously save more money for our clients in those states than the others. But as you probably are aware, the federal tax rate is 37%. And in some states, with the state on there, we're looking at 50% taxation. The issue is that businesses are not set up properly to be able to take advantage of taxes, tax strategies that exist for them. We deal with entity structure. Entity structure is a legal issue, not an accounting issue. And this is not a slam on CPAs, your tax preparers. They do a wonderful job. They do exactly what it is that they need to do, which is make sure you're paying your taxes properly, that you're safe from audit, that you're doing all of the different pieces, but they don't focus on the actual reduction of taxes. And if you want proof of that, try to get a hold of your CPA anytime from last week, January 1 until April the 15th. They're doing what they're supposed to do. We don't do what they do. They don't do what we do, because we come at it from both a legal standpoint as well as an accounting standpoint. And what we do is, as I said earlier, we typically reduce taxes by 20 to 40%. Very, very common for us to reduce taxes by $30,000, $40,000, $50,000 a year. Last year, our highest amount was $193,000 a year reduction in taxes for a $10 million corporation, 2 partners involved in it. So there are huge advantages that are available for you. I'd like to talk with you about what exists, learn more about your business. If you feel like you are paying more in taxes than you'd like to, then you think there's opportunities, potential for reducing that, let me know. We do our working with Breck. We will do a review of your taxes, no obligation, no charge, and we'll tell you exactly how much you would be able to save if you had implemented the strategies that we are able to implement for you. I put my information in the chat. Give me a call. Let's set up a half hour, learn more about your business. Look forward to working with you. Take care.
Thanks, Richard. I love your trick question. Do you think you're paying too much in tax? Who doesn't know they're paying too much in tax? I mean, we went to war over an 8% tax. You know, we threw a bunch of tea in the harbor. That was only 8%. What are we at today? As a corporate?
Yeah, federal's at 37%. Many states were now hitting 50% marginal tax rate, and I don't think it's going to go down anytime soon.
Yeah. Thank you, Richard. Dr. Lewis, sorry for the shortness of time, but people just need to schedule a one-on-one with you. Dr. Lewis has been around the pharmacy industry a couple of years longer than me. He knows the industry really well, and he has an amazing program where he can help you with your profits.
Thank you, Breck. Yes, I do. And I'm going to try to play just a very short video that talks talks about profit acceleration. If I can, let me see.
Of compounding in your business.
Can you hear that?
You change everything in a positive way. Fast. You've likely heard that old adage that if you double a penny for 30 straight days, on day 30, you'll end up with a whopping and almost unbelievable $5,368,709.12. That is the incredible power of compounding and what you're about to experience. We call it profit acceleration. Here's the even better news. What if you didn't have to double your results to see a similar compounding outcome in your business? For example, suppose you sold real estate. You generate most of your leads by attending networking events where everyone that attends has 30 seconds to tell everyone else what they do and then ask for referrals. So you typically say something like this. My name is John Smith and I'm in real estate. I'm looking for families that are searching for a new home. I have 15 years experience and a solid track record. Let me know if you know someone I can help. Now answer this question. Did you find that compelling? Did it make you want to run right over to John and give him as many referrals as you can? Probably not. But what if John said this? My name is John Smith and I specialize in helping families buy homes larger than they thought they could afford. Let me know if you know someone I can help. No doubt you agree that your new message will generate more interest than that of the original. If John's original networking message generated an average of 100 leads per year, would it be safe to assume that his new message might generate 103 leads this year? It's only a 3% increase. You know how easy it is to get multiple 3% increases throughout various areas of your business? We're going to show you exactly how you can do this without spending an additional cent on marketing or advertising. By the way, the agent that used that second message said his leads actually doubled, which is a 100% improvement. But let's keep our impacts conservative at 3 to 5%. When a 3% gain is multiplied over a dozen different areas, you'll generate dramatic profitable gains for your business. Here's the key. If you want to double your profits, you probably don't need more than 3% increases in each of the 12 areas. Small goals are easy to achieve and they cause very little disruption to your business. Yes, you can aim higher, but you'll see the numbers quickly increase exponentially. One more thing. When you achieve an impact in your first area, you earn a certain amount of profit. If you achieve a similar result in a second area, that impact starts to compound. It's not the same. Think of it this way. 3% of 1 million is $30,000. 3% of 1,030,000 is $30,900. Your numbers keep growing like the 30-day experiment that turned a penny into more than $5 million. Click the button below to learn how you can begin leveraging the power of compounding profits inside of your business in as little as 2 hours.
Okay. And I put in the chat my contact information, but yeah, if we can just spend 45 minutes, I can show you at least $100,000 in additional profits this year, integrating a lot of the things that Breck has shared, and be able to analyze the impact that it can have on your business. Thank you.
Awesome. Thank you, Dr. Lewis, and want to thank all of our wonderful presenters who presented today. I will also put my contact information in the chat. My contact information will also have a Calendly link. You're more than welcome to use that link to schedule some time with me if you want any additional details on any of the number of services that or products that were offered today. But again, Happy New Year to everyone. Like I said at the beginning, I've never been more excited about the opportunities for community pharmacy. The last few years have been absolutely dismal. This year is going to be amazing with all of these wonderful solutions that help generate profit, not just revenue, but actually profit that goes to your bottom line. And so I encourage you to please reach out to these wonderful presenters, set up one-on-ones to get additional information. And again, there's my Calendly link in the chat. I will, for everyone who is registered, I will send this replay back out to, along with the notes in the chat. So if you don't know how to save the chat, no worries. I'll be sending that information out to you in an email in the next couple of days. So again, thank you so much. I'll stick around for the next few minutes if there's any specific questions that I can address at this time. But that is the end of the presentation. Thank you so much for taking time out of your busy schedule to be here. And like I said, I'll stick around for a few minutes to answer any questions you may have.
I will as well.
Okay, thank you. Let me stop the recording. So I'll have less to clean up on that end.
I've got to take a call right now, but thank you very much, Breck, for everything.
Yep, thank you.